Good day everyone, I am Jumaika P. Urangan, and for this day, I am going to tackle the etiology and risk factors of tuberculosis. So, pulmonary tuberculosis or TB is caused by the bacteria Mycobacterium tuberculosis or M. tuberculosis. So, you can get tuberculosis by breathing in air droplets from an infected person, so from any activity that the infected person would do. So example of that one, or if the person would laugh, talk, eat, or like even cough, of course, like coughing. So even if he or she is singing, you can get that bacteria from that person. So about 1/3 of the world's population is infected with this type of bacteria. However, only 10 to 20% of people with this infection develop active TB. So when someone who have never been exposed to this kind of disease, he or she will most likely to result to a primary infection. So a person who carries the bacteria but does not develop symptoms has latent tuberculosis. So that is not contagious, but it can eventually develop into active TB, particularly if a person's immune system becomes weakened from a condition such as HIV. So now let's go to the causes of tuberculosis. So first is HIV infection. Next is low socioeconomic status. So for low socioeconomic status, people who are living in poverty has less access of having good and quality lifestyle and quality health care. So these people would only think of what are they going to put on their table rather than thinking of their health. So another thing is alcoholism and homelessness. As for alcoholism, it can really make a person's body go weak. And for homelessness, people who do not have anywhere to go will most likely to stay on crowded places with limited access to health care. So that person has a high risk of getting that disease. So another thing is crowded living conditions. Yes, that one. Then diseases that weaken the immune system. Next is migration from a country with a high number of cases. So for example is when a person is from a foreign country and he or she will go to a third class economy. So let's say like Philippines, well, we cannot deny that one. So if a foreigner or like someone from a foreign country who have high quality of environment of healthcare, he or she will most likely to get tuberculosis because he or she will have hard time adjusting with the environment he or she is staying now. So as for that one, they are very prone to this kind of disease. Another is healthcare workers. So they are also that is also one of the causes of tuberculosis, because healthcare workers would spend most of their time treating and healing people, and that is one of the factors that could weaken their immune system, because they will get exposed to different patients, and facing someone who have tuberculosis is very possible in that state. So now let's go to there. As you can see, those are just some pictures. So having HIV infection, low socioeconomic, alcoholism, crowded places, diseases that weaken the immune system, and healthcare workers. So now let's go to the risk factors. For a moment. So generally, Persons at high risk for developing TB disease fall into two categories. So first, persons who have been recently infected with TB bacteria. Another is persons with medical conditions that weaken the immune system. So first, persons who have been recently infected with TB bacteria. So, close contacts of a person with infectious TB disease. Second, persons who have immigrated from areas of the world with high rates of tuberculosis. Next, children less than 5 years of age who have a positive TB test. So, people who are too young or too old have a very vulnerable immune system. So, they are very prone to that disease also. Another, groups with high rates of TB transmission such as homeless persons, injection drug users, and persons with HIV infection. Another, persons who work or reside with people who are high risk for TB in facilities or institutions such as hospitals, homeless shelters, correctional facilities, nursing homes, and residential homes for those with HIV. So as for the correctional facilities, let's say those are prisons, right? So incarcerated people live only in one place. So therefore, the air cannot move freely. As a result of that one, people who live in that area will just breathe the same air that they exhaled. So that is why, it is very prone. Another thing is, when you are working on a facility, like even something that has closed space, because if you are using an air conditioned, the air cannot get out on the area, so most likely you will be getting also disease from that one. So next is persons with medical conditions that weaken the immune system. So babies and young children often have weak immune systems. Other people can have weak immune systems too, especially people with any of these conditions. So first, HIV infection, so the virus that causes AIDS. Another, substance abuse. Next is silicosis. Then diabetes mellitus and severe kidney disease. So as for these two, people who have low resistance to TB, because there are some medications that could affect the parts once the process or once the healing of treatment will start. Once the treatment will start. So as for that one, complications may occur. So another thing, low body weight, then head and neck cancer, and then medical treatments such as corticosteroids or organ transplant. So for a moment, so how do you know if you should get tested for tuberculosis? So first, if you are a resident of if you're a resident on a place with high risk of tuberculosis. Another thing is if you have a close contact to a suspected person with tuberculosis. Next is if your body's resistance to illness is low because you know in yourself that you have a weak immune system. And last is if you think you might already have the disease. So don't just wait for someone, do it yourself. So as for the last thing, okay, so symptoms of TB disease depend on where in the body the TB bacteria are growing. So TB bacteria usually grow in the lungs. So TB disease in the lungs may cause symptoms such as a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum or phlegm from deep inside the lungs. Then other signs and symptoms are weakness or fatigue, weight loss, no appetite, chills, fever, or sweating at night. So let's go to this one. Although your body can harbor the bacteria that cause tuberculosis, your immune system usually prevent you from becoming sick. So for this reason, doctors make a distinction between latent TB. So in this one, you have a TB infection, but the bacteria in your body are inactive and cause no symptoms. So latent TB, also called inactive TB or TB infection, is not contagious. But if you will not treat this one, then it might turn into active TB. So treatment is very important. And as for the last thing, active TB, also called TB disease, this condition makes you sick and in most cases can spread to others. So it can occur weeks or years after infection with the TB bacteria. So that would be all. Thank you very much and God bless you. Bye for now.